Welcome to Health Yeah, where experts from Stony Brook Medicine come together to discuss topics ranging from the complex inner workings of an infectious disease to tips and tricks for staying safe and healthy all year long.
Hello and welcome to Health Yeah. Now, most of us know someone who has coronary artery disease, and when you or a loved one gets a heart disease diagnosis, it can be very scary. Today, we're going to talk about some of the things you can do to help manage what is the most common type of heart disease, as well as the latest treatment options. And before we get started, though, I would like to have each of you introduce yourselves to our audience and tell us a little bit about what you do here. And Dr. Price, we'll start with you.
Thank you. I'm Dr. Jonathan Price, Assistant Professor of Surgery here at Stony Brook University Hospital. I'm one of the cardiothoracic surgeons, and I treat coronary disease surgically.
And Dr. Patel, you are a veteran. You've been actually on the program before, but we're going to have you introduce yourself anyway and tell us about your position.
Yeah, well, listen, thank you for having me back. My name is Neil Patel. I'm an interventional cardiologist. So the focus of my practice is on the treatment, prevention, and diagnosis of coronary artery disease. I'm one of the physician partners at North Suffolk Cardiology, which is a full-service cardiology practice here on Eastern Long Island. And we've been in a 15-year long-term relationship with Stony Brook Medicine that we're very proud of.
Great. Welcome to both of you. We're going to start off and let's just kind of go with the basics. And Dr. Patel, if you can tell us, what exactly is coronary artery disease?
Yeah, it's a great question. I mean, I think to really understand how to treat and prevent this disease, you have to know what the disease is. So the coronary arteries are three arteries that are on the surface of the heart, and they supply blood to the muscle of the heart so that it can function. In its simplest form, coronary artery disease is the buildup of cholesterol in the walls of the arteries of the heart, and then subsequent narrowing of the arteries, or even worse, abrupt closure of the arteries. Now, if it was that simple, we'd have this thing figured out, because I just told you it's cholesterol in the walls of the arteries, so you would think, let's lower everybody's cholesterol and the problem is solved. How do I know that's not true? Well, we've been doing that for the last 40 years. We've been lowering people's cholesterol, and although the incidence of the disease is dropping, still almost 400,000 people are dying a year of this disease. So I think the better way to look at the disease is to look at it in three parts. And those three parts are the cholesterol, the blood vessel, and your body's immune system. So the cholesterol is trafficked around in your blood in little particles, and the bad particle is called the LDL particle. And when those little particles, which I picture as little ping pong balls ping-ponging around the artery, and those ping pong balls will hit the walls of the artery and then get into the wall, that's the first step in the process. Second step is the blood vessel. So if those ping pong balls are flying around, our body has a defense mechanism, which is the lining of the blood vessel called the endothelium. Mm-hmm. And if that is not doing well or is not healthy, it's much easier for those ping pong balls to get into the wall. And then the last part of the process is your immune system. And so whenever something bad's going on in the body, the immune system wants to fix that. So the more revved up your immune system is to start off with, the more consequential that response is going to be to the cholesterol in the walls of the arteries, and the more you're going to develop plaque and blockage of the arteries.
And once that LDL cholesterol attaches, then you get more and more and more attaching there, and that's eventually what leads to the problem?
Exactly. So it's almost a random process, right? So when you think about these ping pong balls floating around in there, there's no special thing that's causing those little particles to get into the wall. It's just the more particles that are in the blood, the higher the likelihood those particles will get into the walls. And it's happening to all three of us as we sit here, but most of the time those particles will fall right out of the wall and just go on with their business. And so if they get stuck inside the wall of the artery, that's when we got a problem.
All right. So Dr. Price, let's talk about some of the signs and symptoms of coronary artery disease. As we hear it described, I think a lot of people now, we've got their attention. They're probably wondering, am I at risk?
Yeah, well, I think we have their attention because it sounds so cool when Neil describes the disease process. But it's very interesting. So coronary disease is actually asymptomatic the vast majority of the time. I would say that it is most common when I meet patients for the first time who come to me for treatment of pretty bad disease that they've never felt a symptom. They've found this by accident in working up something else, something totally different. And they say to me, listen, I felt as good as I did 20 years ago and I have really bad disease. How is this possible? You must have the wrong patient. So really, it's important to know that this usually doesn't present with symptoms. And the reason that's important is because when a doctor tells you that we need to start modifying things in your life that will help prevent this, it's important because you often won't feel symptoms before the onset of pretty bad disease. However, coronary disease is really just a difference in how much oxygen your heart needs and how much it actually gets. So a lot of the symptoms have to do with a mismatch of the supply and the demand of oxygen in your heart muscle. Most commonly, when they do have symptoms, it can present as chest pain. And that can really be a wide range of types of discomfort. Some people have pressure in the chest. Some people have pain. Some people have weird complaints that either focus around the chest or the shoulders. Some people have shortness of breath. Some people have, they can have what feels like gastrointestinal symptoms, like dyspepsia, or just not feeling well after they eat. And really can present, like I said, in many, many different ways, although it's asymptomatic most of the time. So if you do have any of those things, it's actually very important to take those symptoms seriously and consult with your physician.
So is there something that you can be tested for, like your LDL cholesterol levels? Is that something you would go into your primary care physician and say, hey, I want this tested? Would that help at all?
Absolutely. So, when you first see a doctor and you're looking at your risk of coronary disease, we look at risk factors that are individual to you, that might be lifestyle mediated, but it also could be your family history and your family risk. And it's really up to your physician and you to have a really in-depth discussion about what they think is your risk of coronary disease. And then that would lead to further testing and further, risk factor stratification to see what exactly is your risk. Not everything can be told by a blood test or a scan or anything like that. So it's really a discussion and an honest conversation with you and your physician to see what is most likely going on.
I think it's really important, though, to follow up on what he first said, which is that most of the time this is asymptomatic, because the number one question when people come to the office to see me is the first thing they ask is, how blocked up are my arteries? They want to know a percentage. Is it 10%, 50%, 80%? And we're kind of programmed as humans to think less is better. So if it's 10%, it can't be as bad as 80%. And oftentimes the patient will say, okay, great, it's 10%, I feel fine. The important thing to remember about what he said is that the reason you have a heart attack is not because your arteries have slowly progressed to 80% blockage over time. It's a sudden change in the arteries. And that can happen whether you have 10% plaque buildup in your arteries, 20%, or 80%. And so being vigilant and really testing to find this disease is crucial.
So how do you diagnose?
Yeah, so I think things have evolved a lot in this subject. If you think about your traditional testing to look for coronary artery disease, it was treadmill tests, nuclear stress tests. Everybody has heard those buzzwords. The problem is those are tests that are looking for obstructive blockages in the arteries. So those tests will help us screen to say, do you have a 70% plus blockage in your arteries? What we know is that 75% of heart attacks occur on blockages that are less than 75%. So when the person comes to his cardiologist, gets run on a treadmill, and the treadmill looks fine, to me, that's not reassuring that we've done a good job of looking for this disease. So there are more novel modalities that aren't really novel. They've been around for the last decade or more that involve CAT scan imaging. And there's something that a lot of patients have heard about, which is called calcium scoring. And so this is just a simple CAT scan. Everybody knows what a CAT scan is. This is looking directly at the heart. You slide in, you slide out. It takes a picture of your heart, and it's going to tell you, do you have the beginning signs of plaque forming in your arteries through a surrogate measure of, are your arteries hardened? Is there calcium in the arteries? And that gives you a score from 0 to the thousands. And so you're going to feel more reassured if your score is 0. That gives you a sense that you haven't started to develop any plaque, although that's not a perfect thing, but it allows you to peek behind the curtains. So for the patient who John just described, who feels great, who's riding their bike, who's on the treadmill, it tells them, well, yeah, you don't have obstructive blockage of your arteries, but you have the beginning signs, and that's where the risk lies.
See, it's interesting because I think probably most people, when they're thinking about a disease like this, they think about that 75% blockage or 80% blockage, and if they have that, they're concerned. And if they're 10%, they're thinking, oh, great. I'm a little bit older. I can live with that for a long time, but it's different.
It's the exact thing I see. So when I tell somebody, let's say we get one of these calcium tests and that number goes from 0 to 2,000. And I say, hey, your calcium number is 15. 15 sounds like a really low number, but in my opinion, it's either 0 or it's not 0. Yeah. And if it's not 0, you have started the disease process. And by the time you have calcium in your arteries, this disease process doesn't happen overnight. So that means this plaque formation started about 20 to 30 years before then. And so at that point, when your score is 15, you should take that really seriously, because if you're truly going to prevent things from happening down the road, we shouldn't ignore that mild plaque. That's exactly who we should be targeting.
So, Dr. Price, let's say the score is not 0.
Mhm.
What do you do? What if you get that diagnosis? What should the patient do?
So, a few things. One, I would say the first thing to do is not panic. I think the most important thing to remember is that coronary disease, although it's a scary thing to people to hear about all the bad things that can happen to your heart, it's important to know that you have a lot of people who can help you get through it, who could help manage the problem and keep you safe in the process. So under no circumstance would I tell people ever panic. Then I would say take it seriously. So when someone tells you about even a minor finding, as Dr. Patel said, what we are most worried about is identifying the people at most risk for developing bad disease over time. And the sooner we get to, and the sooner we can start modifying your risk factors to help prevent progression of the disease, the better you're going to be in the long run. So first thing I would say, don't panic. Whatever diagnosis you're given, whatever finding you're told, let's take it seriously and let's have an honest conversation about it. And I think that then goes into the patient seeing their cardiologist and discussing what the findings were and exactly what that means. I find that people often jump to conclusions, sometimes in a very negative way and sometimes in a very positive way. Sometimes a very minor finding and they're already committing themselves to something really bad. But also with minor findings, as Dr. Patel said, they'll write them off and say, well, I must be fine because there's nothing real. It's not that bad. And I think neither one of them is the way to go. I think you need to just kind of identify what the problem is and really think about what that means for you as an individual and discuss what you can do about it to help prevent you from developing disease in the future.
I would imagine, and I'm just speaking from a personal standpoint, but I would imagine probably 98% of the people panic a little bit when they get that diagnosis. Is that probably accurate? And they don't necessarily need to, though. There are ways that people can be helped.
Yeah, I think it's a spectrum of responses, but most people, when you tell them something is wrong with their heart, that's not a pleasant thing to hear.
Exactly.
And so the initial reaction is always
scary.
Panic. Is something bad going to happen to me? And then the second question often is, how do I prevent this from happening? Now, the problem is preventing it from happening is not just taking a couple pills and, watching your cholesterol go down. This is a lifestyle change. And that's a very hard thing to do. But I like to use the diagnosis portion where you show people that, listen, you have a little bit of plaque in your arteries, but also realize this is the most preventable and the most modifiable disease that we know. There's no reason that 400,000 people a year have to die from coronary artery disease because it is modifiable and it's preventable. And so when you get that initial diagnosis, taking it seriously and really going through the lifestyle changes that we need is crucial.
So I've got a question, and this is, we talked about this a little bit when you were on prior, and I think it's important. As an academic medical center, the ability for people to collaborate, physicians, caregivers to collaborate across the continuum is really important. And I think that does set us apart a little bit. I don't know if either one of you care to talk about that, because I think personally it makes a significant difference for the patients.
So I think that is really the biggest game changer in the treatment of coronary disease, in my opinion, is not the individual medications and not the individual doctors, but the collaboration that happens among the different physicians who can help. Because as we'll see, between a primary care doctor, a cardiologist, an interventional cardiologist, and a cardiac surgeon, every single one of those people need to be involved in decision-making for these patients to make sure they get the most appropriate treatment for what they have, at what stage they have the disease, and to keep them safe for the rest of their lives. And that's not on one person. That's on a team of people. And it's uncommon to have a team of people working so collaboratively and really and so in such a dedicated manner for their patients than we have here. And I think that's a very, very important thing that sets us apart from most other places, to be very honest with you.
And Dr. Patel, I remember you even commenting on that last time we were here. And I just thought there was a really powerful message for patients.
From our perspective, as community physicians, having this relationship with the academic medical center is fantastic. So when we identify a patient in the office who has more advanced disease, so let's say they have a wildly positive stress test, they then get referred to me to do an angiogram in the hospital to actually look at the arteries. And if there's something major going on, I'm not waiting to make phone calls and looking around. Dr. Price is floating around the hospital. You give him a ring and he's right there, right? And so it's a continuous care that the patients get. And I don't think that's offered at many places. So we're very proud of that.
Perfect. So how fast does coronary artery disease progress? Is it something that once you diagnose, does it come up? I mean, how fast does it progress?
It's a very slow progressive disease, as Dr. Patel mentioned earlier. This is not something that happens overnight. Now, there are different types of disease, and there's a lot of different factors that goes into how quickly something does progress. But in general, this happens very slowly. So when people present to us for the first time and they have either minor or very, very blocked arteries, the fact of the matter is it's been happening for a very long time. And I always tell people this didn't happen over weeks and months. This happened over years. So when their first inclination is to say, well, am I in any immediate danger? The answer is no. If you didn't come in having an acute syndrome or having had a heart attack that we found this, accidentally looking for something else, the fact of the matter is that, we have time to discuss what the right options are and to come up with a treatment plan that is most appropriate for the patient. But generally, this is not something that is rapidly progressive. It can be in some people. And this is where, some risk factor identification and really identifying what is going on in people's lives comes into account. But overall, this is a very slow progressive disease.
Dr. Patel, can you tell us some of the treatment options, both for maybe mild and then more severe instances?
Yeah, I think it's two different avenues, right? So when you think about treatment of coronary artery disease, the first thing that comes into most people's minds is, when are you going to put the stent in my artery and open things up? Because again, that's the relation that you think, C blockage, open blockage, I'm fine now. And in fact, I find that sometimes that type of treatment gives the patient the wrong impression. Because when you think about a person's coronary arteries, let's say they do have an 80% blockage in one of their arteries. Well, that 80% blockage is not living alone. There's plaque in other areas of the heart. So when I go in and I put a little piece of metal into that 80% area and open it up, I've done nothing about the 20%, the 30%, or the 40% plaque that's living in other areas of the artery. And we already established that those are dangerous, that bad things can happen if those things become unstable. So in my mind, coronary artery disease is a systemic process that we have to treat with comprehensive diet, lifestyle, nutrition, and pharmacologic therapy. And it goes back to what we talked about at the beginning, that there are three parts to this disease. There's the cholesterol, there's the blood vessel, and there's the immune system. And there are a couple things that hit all three of those things at the same time, and those are diet and lifestyle. Exercise. Those are things that are going to reduce your cholesterol levels. They're going to make that lining of your blood vessel healthier. They're going to turn down your immune system so that you're not living in the state of heightened immune response. And if we do those things, you are setting the stage to really be successful with this disease. Now, at the same time, that's not going to cover everything. And so one of the most modifiable things you can do is to reduce your cholesterol levels in your blood. And this, I think, is really important, because another thing that happens, and for some reason we've been programmed and our patients have been programmed to think that when a doctor starts talking about cholesterol, that means I'm going to prescribe you the dreaded statin drug. And I see it in everybody. I can't even say the word LDL cholesterol without I'm not taking that medication. And it's true, because that is the drug we've been using for the last 40 years. And there are side effects to those medications. Now, at the low to medium levels that we use these drugs at, is that a real concern? Probably not. But I want everybody to know that when we start talking about lowering cholesterol, there are many options for lowering cholesterol that do not involve the statin drugs. And we know that for every 40 points you lower your LDL cholesterol, you reduce your risk of a cardiac event by 25%. Wow. So if I lower you from 160 for your LDL cholesterol down to 120, that's a 25% reduction in your risk. If I lower you down to 80, that's a 50% reduction in your risk. You don't find those kinds of odds anywhere else. And so I think it is so important to be open to that conversation about treating cholesterol.
And the positive in all of this, if you catch it earlier, you follow the directions and make those lifestyle changes, you have an opportunity to live a pretty nice long life. Is that correct?
Absolutely. So I think, one thing that it goes beyond people sometimes is they think that this is just basically a terminal sentence when you tell them they have heart disease. Mm-hmm. But the fact of the matter is, this is, as we said, a slowly progressive disease that has treatment options. And there's a lot of people who are available to help manage these conditions and to look after people to keep them safe. So regardless of the severity of the disease, regardless of the treatment that they undergone, whether it be medication adjustments, lifestyle adjustments, or procedures, whatever that may be, people can still live a very long, healthy life, even after having a diagnosis and having undergone some procedure or some intervention.
And Dr. Patel, I imagine just the changes that we've seen in medicine over the past decade, 2 decades, and you talked about this a little bit earlier, but that's made a significant difference in treating folks who have this condition and their ability to live that longer life.
Yeah, I mean, the advances are unbelievable. So when you think about what Jonathan and I do, we revascularize the heart. And I don't want to make it seem like there isn't a role for that type of therapy. So if you have severe disease, 70, 80, 90% blockages in your arteries, and you're getting symptoms when you try to do things. So if you try to exercise, your heart's not getting the oxygen that it wants. There is a huge amount of evidence that says if we put a stent into that artery, which is a little metal tube that opens up that artery, the patient is going to do better. And similarly, if I find a patient who has blockages in all three of their major arteries and they have reduced blood flow to the whole heart, if Dr. Price takes them to the operating room and does a bypass on that patient does better. So the revascularization strategies have come a long way over the last 20 years, but they are good therapies. But even cooler is that we now have the ability to look at what the benefit of our non-revascularization strategies are. So I was mentioning that calcium test earlier. When we look at the CAT scan technology now, there's actually a full CAT scan angiogram that can be done. And then that angiogram can be put through an AI algorithm so you can analyze the plaque that's inside your arteries. And so what I can do is I can get one of those scans and I can see how much of the bad plaque does that person have, which is a lipid-rich type of plaque. And then I can put them on therapy, lower their LDL cholesterol levels very low, get them exercising, get their insulin sensitivity up, and we can see that plaque shift. And it shifts from the high-risk lipid-dense plaque to the more stable fibrocalcific plaque. And we can do that with a non-invasive CT angiogram of the heart.
And I would imagine with the changes with AI and things like that, this is just going to accelerate even as we in the next few years.
Yeah, I think the future is plaque analysis. I think to be able to identify people at a very early stage is the way to make a dent in this disease. Because as Dr. Price said, this is a 30-year runway to get to severe disease. And once you have the disease, you have the disease. So we want to try to identify people beforehand. Once they develop plaque, we want to be able to show them that therapy is actually working. And then ideally, they never end up at the stage where he's cutting open your chest or I'm sticking catheters in your body.
Yeah. Dr. Price, if you seek care at the Stony Brook Heart Institute, what can you expect to see?
That's a great question. Like I said, I think that we offer a service here that is very different than a lot of other places. And the reason for that is something that Dr. Patel alluded to before, in that when you come to see me or him or one of his partners or one of my partners, you're not just coming to see us. You're really getting the entire institution behind you in terms of supporting what you need as a patient. No one is going to, force a therapy onto you or a procedure onto you. What you're going to get is a group of people who are analyzing and looking at you as an individual, identifying what is the most appropriate treatment for your particular disease and how we're going to keep you the safest, the longest. Yeah. Sometimes that involves some advice in terms of lifestyle changes. Sometimes that involves some medication adjustments. Sometimes it will involve us recommending a procedure to you, whatever that may be. But overall, you're going to get a team of people, each experts in their own right, taking care of you as a patient. And I think that is something we see every single day, something that is not foreign to any of us. And I think something that every single patient can expect when they walk through our doors.
That's all the time we have today. Thank you very much to our experts, and thank you to our listeners and viewers. Today, there is a lot that can be done to slow the progression of coronary artery disease, from lifestyle changes to medicines that treat risk factors or surgical procedures to help restore blood flow to the heart. Our Stony Brook Heart Institute experts are here to help you not only lower your risk, but to live a healthier, more active life.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media, Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.